What is this thing and what does it have to do with the new coronavirus going around? We're going to talk about this thing and some more modern day accessories, as well as that crazy coronavirus that we've all been hearing about in the media, coming up in just a minute. I'm Jim Williams, and welcome to EMT Boot Camp. Hey everybody, welcome back. I'm Jim Williams with EMT Boot Camp. And this particular episode, for about a week, I've had this burning urge to cut a video specific to the the new coronavirus that we've been hearing about. We're going to talk a little bit about that in the next few minutes. But basically what I wanted to do then was kind of head it off, and thankfully we haven't had any EMS involvement yet, and I've been slow to get around to it. But anyway, I wanted to give you just a really broad view, one particular source that you can trust, your good old buddy Jim, about what's going on and what should we be expecting. So this particular virus that everybody's been talking about, it's called the 2019 novel coronavirus, or 2019 NCoV for short. And basically, novel means it's new. Coronavirus is just a family or group of particular viruses. Looking under an electron microscope, these viruses have a bunch of spikes coming out of them, and it reminded whoever first discovered them of a crown. So corona is another word for crown. So that's what it is. It doesn't have anything to do with the beer. So your off-duty escapades are safe. You're not going to be at risk through that venue of having any kind of an infection. But coronaviruses, there's only a few of them that are known, 6, 7, 8. But right now, this new one is still in its evolving stages, and there's a lot of information we don't know yet, or the CDC doesn't know yet. So you can expect some changes, even contradicting maybe some of the stuff in this video in the next few weeks, which is kind of neat. It's kind of exciting, but it's also dangerous. So you got to keep your finger on the pulse of what's going on with this stuff just in case. Coronaviruses are responsible for things like common cold. They're also responsible, if you've been around for a little bit, you may remember the SARS virus that was a fuel for a little scare for a while, and also the MERS, or Middle Eastern Respiratory Syndrome virus, that came about a few years back as well. All of those really aren't huge concerns, because now we either know what they do. We know the common cold is going to happen, and it's not a huge risk factor. We know SARS and MERS do have some risk for mortality, but it's relatively low. Even today, the total numbers aren't huge. But this new coronavirus is kind of a wild card. We don't know its history or its game plan, because it doesn't have one yet. Originally, it was in animals. It jumped in China. It jumped over into the human population. They're still trying to do some figuring about what caused that. Normal assumption is food markets and improper cooking and things like that, but they just don't know. It's guesswork. But it's jumped into humans, and then what's scary is after it jumped into humans, it liked it. So there's been rapid spread. Fortunately for us, the overwhelming majority of total numbers so far are still confined to mainland China. Now, the biggest concern to me is, even with those numbers reported for patients that are infected and patients that have passed away, even with them coming out of China and it seeming to be restricted mostly to China, it's still concerning, because the numbers from China, we have to take with a grain of salt, because China has a history of a restriction of information. So it may be that the information that's coming out is flavored a certain way. There are accusations in the media about that happening. We don't know for sure. So that's something to keep an eye on, because we might wake up one day and all of a sudden, poof, there's a lot of real numbers leaked out that are crazy, blowing our minds. We just got to keep an eye on that. Now, in the U.S. this morning, I was kind of surprised, because I woke up and found that we've got a couple new cases. So we're up to 11. This is February 3rd when this is being recorded. But we're up to 11 cases. Now, almost all of them, the only one that I know that was kind of a person-to-person in America was a traveler who exposed their spouse after they came back. Obviously, there's some close proximity there. The other ones all so far have been reported to have contracted the virus in China during travel, and then they came back to the United States. Now, the problem is we don't know a great deal of information about, once you catch it, how infectious are you and when that infectious timeline begins. So the safe bet is to say as soon as it gets into your system, you have the potential for being infectious, and we want to clamp down that person's exposure to other people to break the chain so we can decrease the numbers of infected people. But we don't have a good handle on it yet. So right now, the biggest thing to keep in mind is, even though there's like 15, 17,000 cases now, the huge number of them is in China. There are only a few sprinkled around to other places. 11 people in the U.S. out of 370-ish million people. Pretty good odds you're not going to run into them on a truck in the next few days. But that gives you time to prepare, because eventually you will run into an infectious patient. Now compare that to, for example, this flu season, or 2019, we had anywhere from 180 to 310 hospitalizations, and also between 10 and 25,000 deaths related to flu and flu complications. And everybody kind of blows that off because it's just something we deal with. The numbers are hugely, hugely outnumbering this most recent coronavirus, and everybody's going crazy about corona. So keep that in mind. Just the regular flu is something to be aware of, because even though it's not going to get you, if you carry it into a nursing home on a run and expose a couple, 3 elderly people to it with compromised immune systems, you're spreading death. So if you got the flu, stay home. But anyway, the thing also with flu is preparedness, keeping ourselves fit, getting a flu shot to decrease your chance of contracting it, and then using adequate PPE, which we're going to talk about in just a second. But I just wanted to keep that in your mind. We a lot of times we don't worry about it because EMS age group is different from the common victims of flu, which include the really young and the really elderly. We know the reasons why. In 1918, the Spanish flu got notoriety because it went against that grain. It picked out people in our age range to adversely affect, and it killed millions to the point where it's partly responsible for shutting down World War I. And it's this could go sideways as well. I've not seen good numbers for the victims of this particular outbreak, but there have been reports that they're mostly elderly. But the rapidity of the spread, I really question that in mainland China. I'm wondering how much of it is middle-aged people that are spreading it because they went to work and doing their thing and spreading it to family, etc. So still not good information on that yet that I have seen to adequately report on it, but it's something to keep in the back of our mind. Now, what can we do to protect ourselves from this stuff? Fortunately, we have or should have the equipment and training to do it. The CDC, because this is evolving, they're using common sense. They're using some information extrapolated from the MERS outbreak, and these recommendations will be altered, I'm sure, in coming weeks as we get more information from studying the epidemiology of this spread of past patients. So it's a work in progress. But earlier I held this up, an early version of PPE, the plague mask from back in the 14th century. Back in the day with the plague, doctors, because they thought that foul odors spread disease, they'd made these masks that they would fill with herbs up in the nose part to filter out those smells, and then put this on and walk around and go visit patients. And they'd also wear big overcoats with impregnated with wax to keep the germ, or not the germs, but keep the ick off of them. They didn't know what germs were at the time. And then carrying the classic one, they carry a stick either to kind of poke the person and check to see, maybe they could feel vibrations for a pulse without touching them, which is a good idea, or just to poke the dead body and see how dead they were. But obviously not good PPE for us today. So current recommendations from the CDC for protection against this, a couple of things. For your patient, just like with flu patients, we're wanting to use contact and droplet airborne precautions. So putting a procedure mask on the patient, like a surgical mask, is good to catch some of that crud and decrease exposure to others as you're wheeling the gurney through hallways and such. But that is not adequate protection for us as responders. So if your truck's PPE includes a box of gloves and a surgical mask, your employer is kind of not doing their job. So that's the biggest reason for this video, is I wanted to get this word out. The current recommendations for this, and they're from the OSHA, and therefore your employer's responsibility at a minimum is for you, as respiratory protection goes, is to wear an N95 mask. There are a lot of different brands. I'm not endorsing any particular one. You'll see them that are made completely out of the filtering material. You may see plastic masks or frameworks with the material inserted into it. Either one's fine. Sometimes you will see these masks with an exhalation port embedded into them. Not a good thing for the patient, because when they exhale, they're just exhaling unfiltered air and polluting the environment. So again, another reason for procedure mask. Don't put an N95 on your patient because it's hard to breathe through, and most likely you're there for a respiratory complaint, so you don't want to make the patient worse. So just protect yourself with the N95. Now with the N95 masks, your employer is also supposed to make sure that you've been fit tested for them, so that you can prove there's a good seal and it's going to provide adequate protection. If you have facial hair, just because you like hunting, or if you came back from the Middle East, or religious preferences, what have you, the N95 will not work for you, because the hair will interfere with the seal between skin and mask. So those options are out. Therefore, your employer has to do something different for you. That different thing is most likely providing you with a powered air purifying respirator. Let me bend down here. I should have had this all set up. Again, no endorsement for a product. This is one that my home service uses. This is a 3M Breathe Easy, but basically it's a blower unit, a battery that you can insert canisters to filter the ambient air of different particles or different problems. So you'll see these a lot maybe in hospital ERs for decon. They'll have big canisters for multi-contaminant. It'll be a combination HEPA filter along with filtering media that will take out certain levels of chlorine and phosgene and other industrial chemicals or chemicals related to WMD. Another good thing about this, because of the canister selection, those big canisters are expensive because they filter a lot. But you can also get filters just that are HEPA, high efficiency related or rated, and they're the equivalent of like an N100 mask rather than N95. So those get screwed on, and then the blower unit sucks in the air, filters out the germs, and then passes good air onto you. That good air is put into you by wearing a hood that covers your entire face. A hose connects in the back, supplies the air, and even though it's not tight fitting, that overpressurization blows germs away from you. It keeps the ambient air out of your hood, and you're only getting in that filtered air. This is an example of a hood that's disposable, so one use and then toss it. So that's good. It decreases your time out of service if you have a supply of these, but in the event of an outbreak, you're going to burn through these pretty quickly. Another option is butyl rubber hood. Does the exact same thing, has a attachment for a hose in the back, and it supplies air. You can decontaminate these though, and then return them to service, which is a good thing. Pricey up front, about 300 some odd bucks, but if you use them several times, they're going to pay for themselves. So that's another option. A little bit heavier, a little bit hotter because of that butyl, but they're a good investment. That's kind of my preferred go-to as far as respiratory protection goes, because I'm more comfortable with them. But that's an option. But in any case, whatever option is selected by your employer, they have to make sure that you're trained on them, that you're appropriately equipped with the right size of equipment, and that you're fit tested in the case of the N95. In the case of the PAPR, you're tested to understand how the thing operates and how to make sure it's working correctly. And as I've traveled, I have seen so many people not understand how to use a PAPR, how to select cartridges. They think that because a cartridge comes with a PAPR, it works for everything, and it doesn't. So this is one of the things you've got to take responsibility for your own safety, understand the equipment that you are issued. If you are not issued appropriate equipment, you need to talk to your employer. Package it as helpful, because if something happens, OSHA gets a hold of it, it's going to be a huge problem for them. So that's just a cost of doing business. They're going to have to give you access to the appropriate levels of equipment. All right, that's about it. I just wanted to put a bug in your ear, especially with the respiratory protection component. And again, I didn't want to put tons of time into this because it's evolving so quickly. We're going to see some changes just in the next several days. We'll probably see stuff getting tweaked. So keep an eye out of what's going on so that you can improve your safety and the safety of your family, safety of your coworkers as you go about your normal duty day. If you have any questions about anything, feel free to post them down in the comments or give me a shout, and I'll be glad to answer them. And I'll try to shoot an update to this maybe in about a week and a half, 2 weeks. I think right now we're on a razor's edge where it can kind of go either way. Last weekend it crossed my mind to shoot this, but I kind of wanted to wait and see which way it was going to go, because it can pick up speed pretty quickly. And I'm still not sure if we're really at the breaking point where we should start scrambling. But World Health Organization and CDC both have declared public health emergencies just to make people aware and to increase our awareness and our readiness for dealing with this. Excuse me. There's got to be make sure you cough into your elbow or your sleeve. But anyway, there's got to be a reason behind the scenes for that. And as we see information continue to develop, the standards are going to alter to make better protection for us. So keep an eye on that. Again, all it comes down to is keeping yourself safe so you can be out there helping take care of patients. Got comments or questions? Leave them below. And until next time, I'm Jim Williams for EMT Boot Camp.